Hello everyone and welcome to GP Podcast by Nadia. Right now it's Friday night and as I told you guys yesterday that I will be traveling to Brisbane today, which is on Friday, for celebrating twin holy days of Baha'i religion with my brother's family and my mom here. So today the whole day was very busy and I couldn't get a chance to do a GP podcast, but then now I'm back from the celebration, so I just had to do it because I can't let go of it. So first of all, I would like to thank all my new subscribers, especially from the Yas community where I work, because I did post it in the Yas community today to from all the lovely people to be able to subscribe to my YouTube channel and Spotify channel, my podcast channel. The reason is that I would really want you guys to help me in spreading the awareness about what could be patients' responsibilities in improving their GP experience, because as you could see that my podcasts are usually not directed at GPs. Like, it's not for the education of GPs or doctors. It's basically because I actually view every consultation that I do from the perspective of a patient. That if I was because when I was not working as a GP, I was just a hospital doctor, I used to hate going to GPs. I'm just telling you the truth, because especially, the long waiting times and the energy to get out of the house when you are sick and go and see the patient, go and see the GP. This was actually all a very toll-taking experience in my own life as a patient. So I can understand that when patients are not very keen on seeing their GPs regularly just for checking them out, because as you know, usually after 20 years of age, seeing a GP once a year is actually like you're completely fine, but you're still going to see a GP to get all the blood tests done and a proper examination done to see everything is fine every year should be actually mandatory for everybody. But just that GP experience of not feeling welcome and not getting addressed properly just makes you tired and just is like, who would go and see a GP? Just until and unless you are very sick. And this actually leads to detection or diagnosis of some of the sinistrous medical issues like cancers and all at a very late stage, because patients just do not want to waste their time going to see a GP. So going to see a GP should be a holistic approach, should be a holistic experience for you, for every patient, so that they are keen to go and see their GP and keen to work on their health, both in terms of treatment and both in terms of prevention of any issues, or implying all the preventative strategies in their lives, including vaccinations, screening programs and all. Tonight, because I'm going to make a very, it's going to be small one. Anyways, I always say that I'm going to make a small video, but it always extends up to 7 minutes at least. Anyways, I just wanted to address one issue. I would be doing these small podcasts randomly also on how to make your GP experience better with your help. Because see, we cannot teach all the GPs what to do. They have their own time boundaries, they have their own limitations, they have their own thought process, and I don't think that we can convince GPs to work in a specific way, because everybody has their own ways. But what we can do as patients to be able to make sure that whoever we're seeing as our regular GP knows our mentality, knows our approach, and knows what are we expecting out of them, so that he or she can treat us like that. So for example, number one thing that I would say is these 15 minutes consultations. These consultations really bother me, because in my view, 15 minutes, literally you cannot achieve anything. Yes, you can do some repeat prescriptions, you might be able to do some vaccinations, but there is no holistic approach. So I know that if you are going in a private setting, of course, money is the issue and you cannot avoid this problem. But if you are going to see a Medicare bulk bill GP, try and make a 30 minutes appointment with them, first of all. Second of all, when you go to them, make a list of your concerns. For example, I also know that sometimes GPs can tell you, no, I'm very busy today and I'll only address one concern at a time, which actually is true. I mean, they can be very busy and they can sometimes be very distracted. But what you can tell them is, sir or ma'am or whatever their names are, if you just listen to my concerns. I'm not saying that you should be addressing all of them. We can address them in another setting, in another consultation. Maybe you can prioritize and see that what would you like to address today in my for my experience, and or I can tell you at the end which one is the most important for me. But if you just listen to my concerns, or just listen to them, and then maybe, I mean, just maybe don't tell them promptly, but like say that maybe they're able to find a connection. For example, I'll tell you, somebody having joint pains and vision issues. So apparently they are not related, like vision issues, joint problems, like let's say lower extremity joint problems, knees and feet and all of that. Ideally, there is no connection, but our body works as a system, as a holistic system, and many of the issues in the body are usually interconnected. So for example, in autoimmune conditions like rheumatoid arthritis, Sjogren's syndrome, and many others, this is a whole condition in which these different symptoms exist. Joint issues, vision problems, and many other problems. So maybe when you tell just read out, if you are proactively prepared and you have a list of your problems, maybe if you just quickly read out them for your GP, then maybe he would be like, yeah, that's true. Actually, let's just do some blood tests to find out, or let's just do some particular examination, or let's just do this to find out whether it's an autoimmune condition or not. So that was just one of the tips for today. And thank you so much once again, everybody. And I'll talk to you tomorrow. Thank you. Bye-bye.